Celine is 7 years old. Her parents came to see me with her for some advice because they'd recently consulted an ear, nose and throat specialist who had strongly advised them that Celine needed her tonsils and adenoids removed. Now, she had been suffering with recurrent upper respiratory infections, ear infections, tonsillitis, throat infections, sinusitis. She'd been struggling with these symptoms for more than 3 years. And in the last 12 months, she'd been on 6 courses of antibiotics. They were treating her daily with nasal sprays, antihistamines, nebulizers, and she was simply not getting better. In fact, her symptoms and frequency of infections seemed to be getting worse. So I asked the parents what had changed about 3 years ago when they saw an escalation in her symptoms. At that time, they had moved from an apartment to a charming beachfront mansion. Apparently it was colonial, full of character, and they'd been lucky to keep all the furnishings from the previous owner, which had so much of history and character. But it was since that time that Celine had become ill. So we made the connection that there was something in this new home environment that could perhaps be the cause of her symptoms. I asked the parents if we could do an allergy test to see if we could identify specific triggers that could be causing her problem. Celine's results came back with scores off the charts for dust and for mold. And it was clear that moving from a fairly modern, newly built apartment building to this old colonial house, lots of history, lots of character, probably also lots of dust and lots of mold, was potentially the cause for her problem. So we had to have quite a serious conversation about whether we were prepared to make some significant changes in the environment to try and reduce Celine's exposure to these allergens or triggers. And her parents seemed motivated. They didn't really want her to undergo general anesthesia and quite an invasive surgery if it was possible that we could eliminate the cause of the problem. So we committed to a 3-month trial period where we would try and reduce the exposure in the environment to dust and mold. And how did her parents do that? Well, they needed to get rid of the old furniture with a lot of accumulation of dust, reupholster, redo a lot of the interior decor, make sure that the curtains were clean, make sure that everything was vacuumed regularly, get everything off the shelves, dust the shelves, make sure that all closets and cupboards were aired and ventilated, install dehumidifiers, eradicate mold. It was quite an overhaul of their home. All carpeting, all stuffed animals needed to be removed. We made sure that there were no feather pillows, feather duvets. Everything should be hypoallergenic. And the change in Celine was remarkable. Over those 3 months, it was possible to reduce her dependence on antihistamines, nasal sprays and nebulizing. She started growing, which hadn't been the case before. In fact, because of her exposure to cortisone and just chronic sickness, she'd kind of plateaued in her growth. And so we saw a little growth spurt happening at the same time. She was much more energetic and just a happier child overall because she wasn't constantly blocked up and congested. She wasn't snoring so much at night, which meant that her body was getting more oxygen and more energy. So this case illustrates that it is possible to reduce allergic symptoms by eliminating factors in your environment that could be causing the problem. Now, I'd like to make a point that this is quite an unusual case because we identified only 2 allergens that were causing significant symptoms for this little girl. For most people, we identify a number of allergens, some of which you can't actually eliminate. Let's say, for example, we pick up that you're allergic to a particular pollen or a particular seed or a particular grass. That's not something that we can often eliminate unless you've specifically planted that plant in your garden and we can get rid of it. But things like dusts and mold, we can reduce the environmental exposure for a large part, and that can make a good difference. I've had other patients where we've picked up that they're allergic to a cat or a dog, and it's been a bit of a heartbreaking scenario where they've had to give their beloved fur baby away, but it's made a huge difference to their overall health and well-being. So if you can identify a particular allergen or irritant that is causing symptoms, and if you can eliminate that from your life, you can gain control over allergies and you can reduce your reliance on medications and reduce the complications of constant allergies.